We're tackling Clostridial diseases, one of the most dramatic and high-yield groups in veterinary medicine. These bacteria are everywhere: soil, GI tracts, the environment. Most of the time, they're harmless, but when conditions are right, they flip a switch and unleash some of the most potent toxins known in all of biology. By the end of this session, you'll have a clean mental map of the major Clostridium species, the toxins they produce, and the classic diseases they cause across species. Let's get to it. Clostridia are gram-positive, spore-forming anaerobes. The spores are incredibly hardy. They survive in soil for years, even decades. The key thing to remember is that Clostridial diseases are toxin-driven. The bacteria themselves don't need to invade tissues deeply. They just need the right environment to germinate and produce toxins, and those toxins do the damage. Clostridia into two broad groups. Histotoxic species cause muscle necrosis, gas gangrene, and sudden death. Enterotoxigenic species cause diarrhea, enteritis, and sometimes sudden death in neonates. Some species, like C. perfringens, show up in both categories because they produce multiple toxins. Blackleg is a classic disease of young cattle. The spores are ingested, travel through the bloodstream, and lodge in muscle. They can sit there quietly for months. When the muscle becomes bruised or oxygen deprived, think rough handling, transport, fighting, the spores germinate. The bacteria produce gas and toxins, leading to rapid muscle necrosis. Animals are often found dead with minimal premonitory signs. If you do catch one alive, you'll feel crepitus, that crackly gas under the skin. Blackleg, malignant edema is usually associated with wounds, castration, shearing cuts, parturition injuries, injections. Clostridium septicum enters through the wound, germinates in the anaerobic environment, and produces toxins that cause massive edema and tissue necrosis. The swelling is warm, painful, and spreads rapidly. Mortality is extremely high without immediate treatment. Disease is a fascinating example of a two-organism interaction. Clostridium navi spores lodge in the liver and remain dormant. When liver flukes migrate through the tissue, they create anaerobic pockets that allow the spores to germinate. The bacteria release powerful toxins, leading to sudden death, often with no clinical signs beforehand. This is why fluke control is so important in endemic areas. Is one of the most versatile Clostridia. It has multiple toxinotypes, A through E, each associated with different diseases. Type D is the classic cause of Enterotoxemia in lambs and kids, often called overeating disease. When animals consume high-energy feed, the bacteria proliferate rapidly and produce epsilon toxin, which damages blood vessels and the brain. Type C causes hemorrhagic enteritis in neonates, often peracute and fatal. C. difficile is an opportunist that takes advantage of dysbiosis, usually after antibiotic use. It produces toxins A and B, which damage the colon and cause diarrhea. In veterinary medicine, we see it most commonly in neonatal pigs and foals, but it can affect many species. The key risk factor is disruption of the normal gut flora. This is caused by tetanospasmin, a neurotoxin that blocks inhibitory neurotransmitters. The result is rigid paralysis, the classic sawhorse stance in horses. Horses are extremely sensitive to tetanus, which is why vaccination is so important. The bacteria enter through wounds, especially puncture wounds that create anaerobic pockets. Botulism is the opposite of tetanus. Instead of rigid paralysis, you get flaccid paralysis because botulinum toxin blocks acetylcholine release at the neuromuscular junction. Horses are particularly susceptible. In foals, botulism causes Shaker-Foal syndrome, tremors, weakness, and difficulty nursing. Contaminated feed, carcasses and silage, or decaying organic matter are common sources. Diagnosis of clostridial diseases relies heavily on clinical signs and history because many animals die too quickly for antemortem testing. PCR for toxin genes is extremely helpful. Culture is challenging because these organisms are strict anaerobes and often overgrown by other bacteria. Necropsy findings, gas in tissues, hemorrhagic enteritis, liver lesions can be very characteristic. Treatment must be early and aggressive. High-dose penicillin is the drug of choice for most clostridial infections. Antitoxins exist for tetanus and botulism, but availability varies. Supportive care, fluids, wound management, and anti-inflammatories is essential, but prognosis is often guarded once toxins have taken effect. Prevention is where we win with clostridial diseases. Vaccination is extremely effective, especially for blackleg, tetanus, and enterotoxemia. Good wound care reduces malignant edema and tetanus risk. Avoiding spoiled feed prevents botulism. And in fluke endemic areas, fluke control prevents black disease. Clostridial diseases are toxin-driven, fast-moving, and often fatal. But the good news is that they are also some of the most preventable diseases in veterinary medicine. Understanding the major species, their toxins, and their classic disease patterns gives you a powerful framework for diagnosis, treatment, and prevention. If you found this video helpful, please like and subscribe. Thanks for joining, and I'll see you next time.